بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. My topic today is about the useful animal signs in the body imaging. I collect here some animal signs are useful in the body imaging, hoping you like the video. The signs of esophagus, I will discuss in some examples of these signs. Here we see the bird beak sign or rat tail sign, and these are multiple patients with achalasia, and you see the esophagus is tapered and proximal dilatation of the esophagus with the fluid level. Here we see the esophagus in two patients with transverse folds, and this transverse fold called fill-in esophagus, and the fill-in esophagus, it is found in cats and can be seen as a normal variant in a human being. Also can be seen in patient with reflux esophagitis or other sorts of esophagitis. Here patient with candidiasis, and the shape of the patient with two patients with longitudinal irregular filling defects, giving the appearance of the snake skin sign. The signs of stomach and bowel. Here patient with pancreas, as we see here, involving the ascending, transverse and the descending colon, and we see mucosal folds, and the mucosal folds are thickened with contrast in between the mucosal folds, and this is giving the appearance of armid limb like sign. Sometimes it is called accordion sign. Here a patient with another big sign, patient with biliary stenosis, and also here, and this another patient with big sign or bird of prey sign in patient with sigmoid volvulus, and here patient with intussusception. We see claw sign of the intussusception or beak sign, and this patient also with bull's eye sign, as we see here in the stomach body, bull's eyes, and this patient with metastasis, metastasizing melanoma, and this patient with bull's eye sign with patient with ulcer. Here another patient with bull's eyes with patient with intussusception, as we see here in this example. Here this patient with biliary stenosis and multiple contraction, giving the appearance of caterpillar sign, and also the patient has the pneumoperitoneum. Here the patient with TB, intestinal TB, we see the cecum is contracted and thickened wall dilated terminal ileum, giving the appearance of ghost neck sign. Here, patient with scleroderma, and we see the dilatation of a small bowel with atony, and we see close-up of the mucosal folds also, and we see also the pseudo circulation, giving the appearance of hide-bound sign. Here, patient with horseshoe sign in patient with sigmoid volvulus, and it is also called inverted U sign. Here, a patient with Crohn's disease, we see the contraction of the antrum or narrowing of the antrum and the duodenum, proximal duodenum, giving the appearance of ram's horn sign. And here patient with normal appendix, vermiform appendix and barium enema, and on the CT scan. And the peritoneal signs, we see here patient with cocoon sign and the clumping of the small bowel in the surrounding by membrane, giving the appearance of cocoon. Here patient with ascites, and we see that dog ear sign appearance, and we see density superior to the bladder in the peritoneal recesses, giving the appearance of the dog ear sign or dog ear appearance. Here, patient with pneumoperitoneum, we see the pneumoperitoneum on the both sides, giving the appearance of leaping dolphin sign. Here, this is a patient with multiple patients with seagull sign, and we see here the peritoneal reflection or peritoneal reflection anterior to the rectum, giving the appearance of seagull sign. And this is normal patient. These are two normal patients, and we see also they are thickened here in patient with rectal carcinoma, and here in patient with pelvic abscess. The kidney, ureter, and the bladder signs, there are multiple signs. Here we see patient with xanthogranulomatous pyelonephritis, and giving the appearance of beer bore sign with staghorn calculi, and sign of the beer bore foot of the beer bore looks like this sign. And here patient with two patients with renal cyst with the claw sign or weak sign, and you see the parenchymal compression, indicating that mass it is arising from the, in this example, in the kidney. And here multiple patient with ureterocele here and there, and on the CT scan, giving the appearance of the cobra head sign. Here patient with dromedary hump or splenic hump, and this is a normal variant. And here a patient with fish hook sign, retrocaval ureter, and we see the ureter, it is posterior to the IVC and with hook appearance and dilatation. Here patient with fish hook sign in CT scan, how it is appear, and we see the ureter in the posterior to the IVC with hook appearance. Here another fish hook sign in patient with prostatic enlargement. Here patient with horseshoe kidney giving the appearance of horseshoe sign. Here patient with papillary necrosis as we see here and giving the appearance of the lobuster claw sign, and here also it's seen on the IVU, and here the signet ring sign. Here patient with medullary sponge kidney on the CT scan and blame film, and we see dense multiple dense calcification, and here we see signet ring sign. Here patient with obstruction or with the stranding surrounding the kidney, so giving the appearance of a spider web or cobweb sign, as we see in this example. Here two patients with staghorn calculi giving the appearance of a staghorn. Here patient with zebra type testis due to either atherosclerosis or diabetes or old age. The liver and gallbladder and pancreatic signs. Here we see the left lobe of the liver. It is crossing the midline to the left side, giving the appearance of beaver tail liver sign. And here patient with bull's eye sign, and patient with cirrhosis with regenerating nodules, as we see here with bull's eye sign. Another patient with annular pancreas, and in this example of annular pancreas is incomplete, not surrounding the whole duodenum, and giving the appearance of a crocodile jaw sign. And here the multiple patient with staghorn with gallbladder stones with fissuring, giving the appearance of a crow's feet sign. Also it is called Mercedes-Benz sign. And here patient with liver adenomatosis, multiple adenoma, and here we see the T2 with atoll sign, and the atoll sign, it is hyper intense in the periphery and low intense in the center. And here patient with heart failure, and we see the dilatation of the hepatic veins and the IVC, giving the appearance of a playboy bunny sign or moose head sign. And this patient has a scalloping with of the liver, as we see here, and here there with patient with pseudomyxoma peritoni, and this patient with hydatid cyst and detached membrane, giving the appearance of a snake or serpent sign. And this patient with body carry syndrome, and here we see spider web pattern due to collaterals. And here we see patient with schistosomiasis with the turtle shell sign due to calcification of the eggs in the portal tracts. And here multiple patient with zebra pattern enhancement of the spleen. And vascular signs, we have the calcification of the splenic artery on the blame film and the CT scan, giving the appearance of Chinese dragon sign. And here patient with the fish hook sign of the median arcuate ligament syndrome. And this patient with as we see here, the patient with IVC anterior to the bifurcation of the aorta, giving the appearance of marsupial cava, and this is a normal variant. And another example of marsupial sign. Here, this patient with multiple patients with ultrasound and CT scan, and we see the bifurcation of the celiac artery, giving the appearance of seagull sign or whale's tail sign. Here, patient with tail sign due to philobelith. The other signs are miscellaneous sign. Here we see patient with dermoid with canine tooth sign. And in conclusion, signs are valuable because it is quickly convey complex imaging pattern and often suggest a specific diagnosis or narrow the differential diagnosis and display parts of the mnemonic tools. And thank you for very much for attention. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. Here is my references.